Hello, my name's Emily. I'm going to be your student nurse today. I'm here to provide you with some trach care and suctioning. I've got my supplies right here, which I'll set up in a few minutes. I'm going to sanitize my hands. Before we start, may I please get your name and date of birth? Check your armband. Do you have any allergies? Okay, great. We can get started. So I'm going to start with a respiratory assessment.
We're going to suction that out.
Okay, deep breath. Deep breath. Keep going, deep breathing. Perfect. Okay. Get behind, listen to your back. Deep breath. Okay, you do sound like you need some suctioning, so we'll go ahead and do that. Can you go ahead and cough a few times to mobilize those secretions? Cough, cough. Okay, perfect. So I'm going to start by hyperoxygenating you so that it's more comfortable for you during the procedure. I'm also going to turn on the suctioning machine. And I'm going to get my supplies ready. There we go. Okay. Trach ties over here. My clean gloves over here. My two pairs of sterile gloves. Right, I'm going to open my suction kit.
To make sure it's high enough. All right, here we go. Breathe in.
I'm going to pour the saline in each of my basins. Okay. I'm going to put on my first pair of sterile gloves. Taking care to only touch the outside edges. Touch the inside of my first glove while I put it on my hand. And then keeping my fingers out, my thumb out, put on my second pair of gloves. So I have my sterile gloves on. I'm going to dump out the suctioning portion. It will come out. I can just grab it, everything's sterile. Okay.
Check on two again. All right, I'm going to take that unit 10 and leave it out there.
So my right hand is going to be my non-sterile hand, and my left hand will be sterile. Everything's still sterile right now. So I'm going to come over here. I'm going to attach the suctioning portion. With my non-sterile hand. Okay. And then remove his mask. I'm going to insert the suction part 6 to 8 inches and until I hear him cough, cough, cough. And then I'm going to slowly rotate the suction part out, pressing the button, no longer than 15 seconds. I'm going to replace this, keeping my left hand sterile. Oops, this came undone. But I'm still sterile on my left hand. This thing is just loose. And now I'm gonna listen to give him another respiratory assessment. Deep breath, deep breath, deep breath, deep breath. Good. 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 Listen to his back. A little bit awkward since I only have one hand. Okay, you sound much more clear. As long as the patient feels better, like they can breathe a lot better after the suctioning, I would be done. If he needed another round of suctioning, I would place my suction portion into the saline, rinse it, and repeat the procedure. But he's good right now. So I'm gonna remove this. Turn off the suction. Get rid of this part. And now I'm going to remove my first pair of sterile gloves. I'm going to put on clean gloves. Prior to putting on my clean gloves, I would hand sanitize, but I have my clean gloves on. So I'm going to take this off, remove this portion, put it in one of the bins. Now I'm going to take off my clean gloves. And now I'm going to put on sterile gloves, my second pair of sterile gloves. Taking care again to only touch the outside edges. Grabbing the inside. With my next hand, I will stick my fingers underneath the cuff, have my thumb out, and put the gloves back on.
Last video was better?
Touching only sterile to sterile, I'll adjust my gloves. So now I have sterile gloves on. So I would remove this portion from the saline and clean it. I would go ahead and rinse this off. And then put it back in. And now I'm no longer needing to stay sterile. Okay, put the oxygen back on. I'm going to provide him some stoma cleaning. So I would take my Q-tip, use my little box of saline to clean, remove this, remove the old gauze, and clean the stoma, noting for any redness, swelling, or discharge. I would dry the stoma. This entire time I would be monitoring for signs of hypoxemia and watching his O2 fat levels, make sure he's good. And now I'm going to put on new trach ties. That was not on well. I'm just going to move this for a minute while I put on your trach ties. Back on for a second so that you can breathe, okay? While I lift you up. One more time, take that off. Sorry, it was hard to get on there. And make sure that that's on correctly, and I would take off the old trach ties. It's on there. Okay. And I would put on a clean, pre-cut gauze. Last time. Okay. Put his oxygen back on. Now I'm gonna go ahead and done. So what I would do is I would put his oxygen level back to the normal levels. I'd make sure he has his call light. I would note the sputum that I took out, note for any unusual color, consistency, that type of thing, and then I would document how he tolerated the procedure. And that's it.